Hi, I'm Dr. Aditi Tandon, and today let's speak about hysterectomy. So simply put, a hysterectomy is removal of the uterus, cervix and fallopian tubes. It is usually performed via laparoscopy or vaginally. In instances where it may be too large to remove laparoscopically or vaginally, or in cases of cancer of the ovary, it has to be performed by an open abdominal hysterectomy. Most large uteruses can be safely removed by laparoscopy. In laparoscopy, 3 to 4 holes are made on the abdomen through which the laparoscope attached to a camera and instruments are put in to reach the uterus. The abdomen is then visualized on a monitor to perform the surgery. Do ensure that your gynecologist is trained for laparoscopic surgery. So let's understand when one needs a hysterectomy. A hysterectomy is one of the commonest procedures that a gynecologist performs. It is needed for large and/or symptomatic fibroids, endometriosis, adenomyosis when the family is complete. Other reasons you may need a hysterectomy is for heavy or prolonged bleeding when medical management fails, for endometrial cancer, for some cases of operable cervical cancer, for ovarian cancer, for some precancerous lesions of the endometrium and the cervix. Often it is needed for cases where there is postmenopausal bleeding, that is bleeding after stopping of menses. Often it is needed for a thickened endometrium. It is also sometimes needed for prolapse of uterus, where the uterus descends outside the vagina. The decision whether to remove the ovaries or not depends on the indication and on the age of the patient. In conditions like cancers, endometriosis, and if the woman is over the age of 50, the ovaries are preferred to be removed. So how is the surgery performed? The attachments of the uterus are coagulated and cut, and the uterus is removed through the vagina. So the vagina is also cut open, and this cut is then sutured, which is why it is recommended to not swim or have intercourse 3 months post the surgery. Recovery after a laparoscopic hysterectomy is quick, and you will be able to resume work almost 10 to 15 days post the surgery. In fact, you will even be able to walk the next day after your surgery, and this is the greatest boon of laparoscopy, quick recovery. I hope this video was helpful, and if you have any more questions, do drop them in the comments and we'll answer them. Also, do give us a like, share with friends and family, and subscribe to our channel. Thank you, and until the next one.